Well, hello. Welcome to What the Flip podcast. I'm your host, Victor Vogel. We're streaming live on both Facebook Live and YouTube Live. Um, and this week, and for the next couple of weeks, maybe three or so, maybe a little bit longer, I'm going to be delving into the area of America's healthcare system. And last week, we actually talked about the U.S. per capita healthcare spending and how it nearly quadrupled from 1980 to 2018. And you're right, I said quadrupled. That it's a horrendous jump, and the graph I showed was like a straight, graph straight up. It was amazing how people were just responding to that. But it was pretty amazing to discover um, how much the cost of healthcare has bloomed from 1980 to 2018. And I saw a lot of that. So we're going to continue on that process tonight. And we're going to take a look at a different world, so to speak. Today's fact question now that we know that it zoomed and it's shot out of sight, we're going to be talking about U.S. healthcare spending is almost twice as high as the OECD average. Now, just before you ask the question, what in the world is OECD? I'm going to explain in a minute. I wanted to just recap a little bit. We're doing 12 fact-based statements here that will go a long ways to informing you about healthcare. And my goal here is for you to have enough knowledge about healthcare to intelligently talk to anybody about it, and also to provide your representatives and Joe Biden and everybody else who's going to be dealing with healthcare over the next year, particularly during this pandemic, uh, good information based on knowledge and your depth of knowledge on healthcare and how it's impacting you, so you can respond or write memos or letters or whatever talking about how healthcare is impacting you while they're trying to put together a program that will take care of everybody in the healthcare world. And perhaps you'll see that one, it's complicated, but two, it is solvable, and a lot of other countries have done it. So that's sort of what I want to talk about relative to the OECD. What is that? The OECD is the Organization for Economic Cooperation and Development. And it's an international organization of a lot of countries, and member countries of this organization all have democratic systems of government. So you'll see that there are a lot of countries in there uh, that think like we do. And there are countries that basically promote a free economy. They're democratic in how they're run. Uh, it, they're a lot of them mostly were originally in Europe, but there are now some non-European countries like Japan and South Korea and Mexico and Canada and just a lot of countries, Australia, and just a lot of other countries now who contribute data into this organization for basic comparisons of healthcare quality and cost in terms of how they're managed, etc. And that is what the European countries are like. Now, the United States spends much more on healthcare as a share of their economy. Basically, according to the OECD and the WHO and those groups, we spend about 17.1% of our GDP, gross domestic product. That's the market value of just about everything we ever sell. Using data from the World Health Organization that in other countries that are basically in this OECD program. Okay, so So that's a lot of money we are spending uh, for just healthcare. 77 out of all the money that's earned in this country, 17.1% of it is put towards healthcare. And so you have to ask how does that kind of compare? Well, if you look at a country like Germany, they only spend 11.2%. That's still pretty high, but it's only 11.2%. And then you have a country like the United Kingdom, which is only spending like 9.6% of their GDP, so to speak, however they manage that in their countries. Now, public spending uh, by the United States for healthcare is about 8.3% of that 17.1. That's the public side. That's us, folks. Us. Think about that. Out of everything that is collected in revenue and spent, we spend about, the public, us, spend about 8.3% of our GDP. And it's roughly similar to the public spending by other countries. So public spending really is associated with how much the government puts towards the government towards the spending. So and this will help you. I think get a little bit better grasp on it as we go along. But it's really only when the private spending is added to the United States that it far exceeds the other OECD organizations that are out there now. And maybe a graph will help you understand this a little better as we go through it. So let me just pop this up. There we go. So what you're seeing here is on the bottom are some of the countries, the primary countries that are comparable to the United States in economic programs. And on the left, you see their percentage of GDP. And what they were saying was along this bottom portion here in the dark green is the public spending. Basically, kind of what the governments are spending on healthcare for each of these countries. And notice the United States is down here pretty comparable with Japan, Germany, France, Canada, and other countries. There's a couple of that are lesser. Where the difference comes in relative to the spending is when you start looking at the private side of it. And here is the green, the light green. That's where the private citizen and private corporations are spending money on the healthcare. So there's two gamuts that are measured here. What the actual government itself spends, and then what the private sectors for each of those countries spend. And herein lies the real big difference between us and the rest of the countries. Now, a lot of people, when they look at these other countries, they don't realize, for example, that they may have a government-run healthcare system, but there are private factors associated with payment into healthcare within those countries. But they are so much smaller a percentage of the whole amount than the United States. Look, I mean, we outstrip everybody here. And this is, so you might think of like, in the United States, the dark green really is basically Medicare, Medicaid, okay? And what the government is covering in that area. And it is going up every year a little bit because, there's an older population increasing in our country. But it's not just about age, and it's about how this money is managed in organizations. So what this really does is it distinguishes the spending on the basis of the ultimate payer. In other words, when you combine these two things, the ultimate payer is this amount up here. This is what the ultimate payment to healthcare is up here. And what happens is the government payments to private providers in these countries, as well as the United States, are counted as public spending. So what happens is this may be even a little more costly on the private side, because what's going on is the government for example, here in the United States, if this portion, the Medicare program, there are what we call supplemental insurance programs that cover supposedly what Medicare doesn't cover. They add to it so that you don't have to pay anything, where you might pay 10 or 15% of something if Medicare didn't cover it. So those supplemental plans also add in certain other little features like eye care, dental care, home care, and various insurance companies have various approaches to doing that. They offer different things, and they compete based on those offerings for your dollar, to have them represent you in addition to the Medicare program. So the rest of that is people who don't have Medicare, who simply pay into a private insurance company. And there's a significant difference here, because when you look at these countries, all of these countries, France, Germany, Japan, Canada, the United Kingdom, Italy, they all have government-sponsored payer programs. The government pays the healthcare system. They may pay the private industry to manage or facilitate the management and processing of that, but they do all of the negotiating, they do all of the payment of the healthcare systems, where in the United States, the government under Medicare does the payment process system. And so actually Medicare is a single payer process system. It's where the government pays for the health care, and they manage that through, like these countries here, through maybe a private health insurance in industry. So in this case, that's exactly what's happening with Medicare. You'll have someone like United or Humana or Blue Cross Blue Shield. Well, the government is funding and paying for the health care, but these companies up here are actually processing that Medicare claim. So the hospitals don't file a claim with the United States government. They file it with the insurance company, and the insurance company handles all that. When it's all settled out, the government pays that insurance company what they need to pay to those hospitals to cover whatever happened to you. Okay, so that's how that works. I'm not sure everybody quite understands that about Medicare, but that's how Medicare works. And so what happens is you find, for example, anything outside of Medicare, people in these other countries, everyone is covered under something like a Medicare program. So they're not involved, and insurance companies aren't involved in negotiating pricing and what can and cannot be done and all of that. That's all set by government plans. It's fixed. It's stable. Everybody knows everything. Basically, all this is an administrative processing. It's a very efficient administrative processing because the government's already negotiated all the cost. And that's what happens with Medicare. Now, let me give you a real good, clear example. A couple of years ago, this coming January, it'll be about 2 years, I fell on some ice and broke my hip. I had to have a full hip replacement. Okay, the price tag on that full hip replacement was $75,000. That's what the hospitals, doctors, drugs, everything associated with that, ambulance, all of that stuff. lumped into one was about $75,000 total. It ended up being negotiated down to $33,000. Now, it was not the health care provider that I have, supplemental provider I have, that negotiated that out. It was Medicare. And what that health insurance provider that I have is able to do is go to all of those doctors and everybody and say, this guy's under Medicare. You're a Medicare in-network provider. Therefore, you can only charge this much. You may think it's worth this much, but this is all you can charge. And then they negotiate it down. So that $75,000 bill dropped to $33,000 there. Now, this is a part where, my Medicare and the little bit of extra insurance payment that's going to be made by my provider, combine those two together, I ended up only paying about, I don't know, $1,100 of that bill overall. Okay. And so you have to ask some serious questions. Why was, if I wasn't on Medicare, how much would I have been able to negotiate that $75,000 down? Just by myself and my little company here that represents me, is supposed to represent me and do that. I'm guessing I wouldn't have gotten it anywhere near $33,000. Okay. So, and then, and so that's how the private insurance companies vary. Plus, on top of that, I pay virtually nothing for my medical portion of my health care. Everything that's charged to me pretty much is, maybe, I don't know, $75 a month or something like that. And then I have another $100 on top of that where I have dental, eye care, and dental and eye care might be all I actually have under that. And those additional cost me to be able to get discounts on, and reduce the rates on those. And those all happen as exams once a year on a regular basis. So that's how that works. If you go into the hospital, then you're talking about, do I have a $5,000 deductible, a $10,000 deductible? Under Medicare, that's all pretty much handled because it's all covered at 100%. It may not be covered at 100% under your private plan. And herein lies the problem. All the private plans differ. Then all the same for my private provider may be different in Michigan than it is in Oklahoma versus where I was in Texas versus where I was raised in Florida. It could be different in any of those different areas in terms of what they will pay and what it costs. In addition to that, I moved from Oakland County in Michigan to Livingston County, just a 20-mile difference. And the price structure all changed and everything all changed. Providers, everything all changed. See, that's the dilemma. That's not the case in these countries here. These countries here, it's consistent across anywhere you go in the country. Anywhere you go in the country, not maybe across countries, but anywhere within France is the same. Anywhere within Germany, it's the same, generally speaking. You don't have those variables that you have with the private insurance companies over here. On top of that, when I was having this surgery, okay, I went to the emergency room. It was in Brighton, Michigan. I said, take me to the Brighton, emergency room, to the ambulance people. And they took me there. And Brighton was an in-network hospital for my supplemental provider. It covers Medicare. Nearly every hospital covers Medicare. So I went there. I saw the admitting doctor for, I'm guessing, maybe less than 8 minutes. She looked at me a couple of little things, listened to what I told her I felt, and said, go get some x-rays. I think you broke your hip. Then they didn't having a surgeon there that could handle anything in a short period of time. So they sent me up to Ann Arbor, Michigan, which was another ambulance ride. So, but that's not the problem with that. The problem was this doctor was in an in-network. She was working the in-network hospital I was at, but she was not an in-network doctor. So, I looked at my bill when I was getting this back, and I got well, looks like she was covered along with everything else under Medicare. So I was running along happy, and then about 4 weeks later, I get this surprise bill that everybody talks about for $1,500 from this admitting uh, emergency doctor at the hospital. And I called my insurance company and I said, I'd like to understand what's going on here. So they said, we'll handle it. So I know what they did. They went back, they talked to Medicare. Medicare said, hey, you were working in an in-network hospital. This is all we're going to pay you. And we're not going to, you have to negotiate the rest with your client. And that's not a good sign for a doctor because most people aren't going to be able to pay that. There's a large percentage of people admitted they can't pay that, particularly senior citizens. So the doctor has to make a decision: do I take what Medicare is going to give me, or do I take a chance on suing these people and not getting anything? And so she negotiated down to the Medicare amount, which was from $1,500 to $390. So you have to ask, what was $1,500 for 8 minutes? What was that about? And then why would you take a reduction if it wasn't worth that? Why would you take a reduction down to 390? And by the way, $390 for 8 minutes is not a bad hourly rate if you want to kind of multiply it out. So that's what's going on. None of that is happening in these other countries. That's why this green line is so much smaller than ours because you have people charging triple prices in different parts of the country for the same surgery, for the same, administrative aspects of running the hospital, all of that. It's a reason why when you buy your Tylenol extra strength uh, medication, you get it for maybe 20 cents a pill. If you allow the hospital, or actually you have to let the hospital, that's one of the conditions of the hospitals when you sign in, is you have to take their drug medicine when they're giving it to you. They prescribe it to you. You get charged like $10 a pill. See, and that is the gap. Those are some of the things that's going on here about how much the difference is between these OECD countries and the other OECD countries like not others, just the United States. We're the only one doing this. Out of all these countries that are in this organization, there's a lot more than this right here. We're the only ones doing this. We're the only ones with this kind of pricing where the person who is not under Medicare, is not being taken care of by the government, is paying astronomically higher prices for so much more. And it's really pretty fascinating to me. Almost all of U.S. healthcare is privately provided, by the way, and 51% of the spending is paid by families and nonprofits and businesses. So it's always amazed me that I ask the question, why are people against Medicare for all? If I can have virtually, almost no payment every month for health care that covered that handled this scenario I was talking about. It took it down. I'm telling you, the difference that private insurance provider made was virtually nothing. All of this was negotiated out of Medicare. That's what I resolved out of, and it took me, like a lot of time. It was like pulling teeth to try to get people to explain to me what happened. But it basically, the negotiated price from 75,000 to 33,000 was the uh, the Medicare people did that. It wasn't the provider. And then the little bit of money that they get for providing me that service from the government, and the little bit I pay them, which in some cases is nothing. If you have a very high deductible, you pay nothing. But if you have a lower deductible, then it's going to cost you something for them to do that negotiating. So all I'm saying is, why do people argue so hard for a private insurance company that charges you so much? And basically, Medicare gives it to you, frankly, for free. Now, it's not free, but your taxes cover it, and other things cover it. But if you took the money that people, this part right here that people are spending, and you eliminated this, or at least brought it down to this level, it would far, far cover any tax increases anybody would receive. Now, under our president coming up, Biden, he said nobody over $400,000 is going to get taxed. So that's a vast majority of Americans that wouldn't have it. You have to understand why people are okay with this program, considering other countries are doing just fine, like Canada is just north of Michigan here. Uh, that's kind of amazing. So basically, the vast majority of the difference between these countries and why we cost so much more is being paid for by private citizens and then companies. Why in the world would companies be pushing for private insurance when, in fact, if they had a Medicare for All program, they don't have they don't get involved in your health care insurance. They don't have to pay a percentage of it. They don't have to ensure you enroll every year. I mean, my gosh, I was in these companies. I'm sitting here asking myself, why would any company fight that? And it is not communism. Okay, I know uh, the there are people who feel like this kind of a program is communism, and they equate socialism with communism, and that's because you really don't have a clear understanding of that. Now, I have some videos about that that I believe I have posted on my Facebook page under What the Flip podcast in various series. So you can go look at those videos. If not, I have them on my YouTube channel, Victor L. Vogel, on my YouTube channel. And they talk about, so you can understand the difference between communism and socialism, and communism and capitalism. And so you have to ask yourself, what's going on here with this? Why in the world? And so this is in contrast to those countries that also rely largely on private providers, but the government as their payer, like Canada, okay? So yes, it's not about the government payment. Where we are equal, actually maybe even a little better in some of these other countries in terms of cost when the government gets involved in being the payer of healthcare. It's where private industries get involved that every private citizen here and those companies are increasing the cost of healthcare with private citizens. If you eliminated and put government, we would all be on a pretty much equal footing. So in those countries, they rely both on public health care providers and public funding, like the United Kingdom does also. So the United Kingdom, if your health care providers and public funding, the countries rely on both public health care and providers, care providers and public funding. So it's just a matter of when you start getting the private people involved in this thing where they're trying to make profits, that's where we see everything go out the window in terms of the efficiency and effectiveness of keeping the costs down. Note the countries shown in Figure 2 are higher income. They're higher income in they're advanced nations with near universal health coverage. Okay, and that means universal health coverage means, and these countries over here, the OECD countries are listed here, have basically coverage, healthcare coverage for everyone in the country. You don't have to worry about whether you can't be rejected for anything. You're going to get accepted in the hospital. You can't be rejected. They can't refuse to pay your bills. It's just covered. You go in and you come out, and you don't have to worry about. Not true over here. You got to worry about your deductibles. You got to worry about whether or not you can afford to go into the doctor. You got to worry about whether you're in network or out of network. This is the most complicated, the silliest program that you could possibly ever put together for a healthcare system. It's so complex, so ridiculous. Nobody understands it. Absolutely nobody understands it. Okay, and so the meaning, this is the gap in spending is not primarily explained by the differences in coverage rates or what they're charging you for this, or income levels of anybody who's involved in this, but rather by differences in healthcare institutions like your insurance company, your conglomerate, hospital groups, pharmaceutical companies, etc. And their policies related to that, which vary widely across companies, across states, across counties. I mean, it is so extremely complex. And I'd like to say it's just for the healthcare insurance, but I had the same problem with car insurance. In Oklahoma City, if I moved from Oklahoma City to Yukon, my car insurance went down. Same car, same driver, same within a month, it dropped in half. I moved from Yukon, Oklahoma to Wixom, Michigan, which just outside about 40 miles west of Detroit, and my insurance from a car tripled up to 300 and some odd dollars. Same car, same driver. How does that work? How do you put all those calculations together? What makes that work? And it's the companies and how the companies are managing their personal individual policies, some of which bump into each other inside the companies sometimes. It's astounding. It's astounding to watch. So the question you have to ask is, we know we've quadrupled our spending from 20 to 2018, from 1980 to 2018. We see how we compare to these other countries in terms of how we operate and they operate. So the question then begins, what, for all this extra money we're being charged, we should have far better health care than anywhere else in the whole wide world. So what do Americans get for this additional health care? Well, life expectancy at birth is the lowest of the countries in Figure 2. Hey, when you're born, the expectation to when you die is lower. In other words, maybe a country when they're born, your expectation is to live to 85. In America, it might be 75. In fact, it's lower than any other of those countries. Something we should have a handle on, for example, like mortality. Maternal and infant mortality are the highest anywhere in these countries. The United States has the highest of any of those countries. We should be leading in this category, not being the worst, especially if we're paying this much money. But then we have people going, oh man, I like what I have. I'm trying to figure out how. I asked a person sitting with me one day, how much do you pay? Here's what I get from my Medicare. How much are you paying? He was paying $11,000 a year. I pay 1,200 at the most. Really? Really? You love what you have? Oh, it's a great plan. Really? So what's your deductible? It's a $10,000 deductible, but that's to keep the price down a little bit. So if you had like a $5,000 or no, can you get a no deductible? No. Well, I have a no deductible plan with Medicare, and you're paying $11,000 and I'm paying 1,200. Help me figure this out. It does not make sense, folks. So other non-healthcare factors contribute to this. I mean, the cost of healthcare. There's a lot of factors affecting. I mean, we are an indulgent country. I mean, we won't even wear masks to keep from killing us from a pandemic. That's costing millions and billions of dollars. Simply because we won't wear a mask. And consequently, more people are hospitalized than ever before. And you want to start adding up those bills? If you're not on Medicare, are you covered? If you don't die, I'm guessing you're going to basically be financially ruined for just being in the hospital a month on an incubator. So you don't have that problem in these other countries, folks. That nobody is suffering that problem. They're not suffering a financial loss on top of the pandemic. So that's part of what this is all about. That you need to be aware of, and this is just an introductory to you. You really need to go in there and dig out and find out more about this. Ask questions. Find out what is really, really happening. Okay, so let me kind of get rid of this chart right here, although that's probably something we ought to keep up there for you. Summary, factors affecting high cost in America are primarily due to private industry, businesses, administration, and how that's operating. That includes hospitals. Hospitals are not public, folks. They're private. They're private, except for the VA, but every other hospital is private. And what you're having is a bunch of hospitals buying other hospitals. It used to be you have a bunch of independent little hospitals, particularly in rural areas. Then you would have, satellite little hospitals pop up from these corporations that own this hospital. And then they started engulfing other hospitals and they get bigger and bigger. And then they force doctors to work within their system. And we're going to find out a little more about that. So this is not about your doctor's charge. It's not about the nurse's charge. It is really about the conglomerate and the businesses of healthcare in this country that has caused the havoc. And it's caused the cost to accelerate, and it's caused the quality to go down. That's what we know for sure. So let's see, American healthcare costs more. We're summarizing. American healthcare costs more, and our healthcare is comparable a little bit in many cases, but less effective in a lot of other cases than other democratic countries that are out there. So, and these are statistics gathered by all of these countries. Now, if you ask people in America, we got the best healthcare in the whole wide world. We don't know. You haven't been in the whole wide world yet. So, we tend to, when we're focusing internally, we tend to miss where we stand with the rest of the world. Okay, the pandemic's brought many flaws into focus, and this is so true. People losing healthcare insurance en masse because of layoffs, and that aren't really attributed to anything they did. That's happened. That's happening right now. It's about to happen because we can't get anybody, well, not anybody. It basically falls on the Republican side and Trump. we can't get them to sit down and pass something that should have happened back in May. If you want to know, I don't care whether you're Republican, Democrat, or whatever, if you're hurting and you're about to be evicted and you've gone through your savings and you've lost your job and they've shut down your businesses or whatever to save lives, and you're asking, where is that money that we could have had back in May if that Republican Congress, Senate, not just Congress, but the Senate had passed the CARES Act, you would have had $600 in your pocket that first or second week of May. So in May, you would have had $6 a week, $600 a week. For 4 weeks is $2,400. Okay. Take $2,400 from May, June, July, August, September, October. That's 6 months, folks. That's $14,000 that you would have had in your pocket that you don't have because they just didn't think we needed to spend the money. It is a fact. I mean, it was sitting on the table for them to sign. We did it in April. No, we didn't do it in May. We have a better idea. I don't know what the hell their idea was, but it cost you about $14,000 in just the supplemental unemployment if you were unemployed or you felt like you didn't want to go to work because you might die. Okay. Then on top of that, with our great healthcare system we have, we are taking your healthcare away from you because you don't work for us anymore. It's gone. Boom. Now, oh, by the way, you can have COBRA for 6 months if you want to pay 105% of the full price of healthcare. You can't afford it. You can't afford it because you don't have a job. It is so absolutely ridiculous. Not true in Canada. You lose your job, you still have your health care. You still have your health care. So why are you so excited about America's private health care system? I don't understand why anybody could be excited about myself. I mean, I'm excited about Medicare. Hey, I'm okay. I'm okay, guys. I have Medicare. What basically Bernie and Biden and the Democrats were saying we would like you to have. And if you're a Republican saying you don't want it because you're afraid of socialism, uh-oh, well, now you don't have it. You don't have 14,400 some odd dollars in unemployment. You don't have any health care. And by the way, you're probably going to get evicted. I don't understand it. But if you're excited about it, I'm glad you are. I'm just glad half of the other country isn't. American healthcare system under the pandemic shone a bright light on the disparity of wealth and the impact in the system and how affordable it is. I mean, people are taking significantly large deductibles just to have some kind of health care, and it's not good health care. It's nowhere comparable than if I went across the border in Canada and applied to live there. And, you know, healthcare is automatic. It's just automatic. Not here. Not here. Not in America. The biggest, best, make America great country in the world, and we can't even take care of the people in the country. Really? Okay. So that's my pitch. But, you now need to ask yourself, so what else do I need to know about this healthcare system? What else can I find out? And we will be covering some other topic areas as to how this healthcare system gets screwed up the way it is. We know it's due to management and the institutions and the private side of business. It's not due to the government. In fact, health insurance companies are managing this so poorly. They asked Medicare to consult with them on how to negotiate better. Yeah, that's a fact. So, and I don't know where it came from, but you can go find it. Yeah, I do. It came out of a book from two guys who used to be healthcare collectors. They used to bug you for the money for not paying your hospital bill, and they stopped doing that, and they created a um, nonprofit organization that could help collect money, and they wrote a book on what was going on healthcare and the insurance companies in America. And that's where I learned the whole idea that you know it's just ridiculous, the stuff that's going on. And I'll put that link when we get to that segment. I'll put that link into the description of the pages so you can go find that book. If you really want a great read that opens up your eyes about our healthcare system in America and why it is so screwed up, and it is, then read this. If you're if you're an always Trumper, you're going to read it and throw it and burn it in trash, so don't spend your money on it. But if you're someone who is thinking, yeah, what he's saying is right. Why am I paying so much, and why are people on Medicare not paying this much? Same surgeries, same surgeries. Okay, if you fell and broke your hip, you'd be charged $75,000. I was charged 33. That's a start. And that then you have to talk about the differences between what the private company would pay. Oh, by the way, if you have a pre-existing condition without ACA, they would have just said you can't do this and you can't do that. I don't know. You know, I just know what I see when I see it, and I know what happens when I watch it, and it does not make sense. So that's why I'm doing this series, to try to help people understand what the hell is going on in our healthcare system. Learn about it, because if you learn about it, you maybe if you take the time and open up your eyes and stop being blinded, just open up your eyes to information, you might find that it's going to help you when it comes time to figure out what we need to do with this system. You can actually write a cogent letter to your congressman or whatever explaining your situation, how it affected you, and that would give them good concrete information to help solve the problem. Okay? And I don't know what the solution is. I know there has to be a better solution than no Medicare for all. Let's throw that out. And no, let's throw private insurance out. There's a better solution. Okay. But you got to first buy off on the fact that you have a wreck that you need to fix. You have a wreck that you need to fix. If you want it to run properly, you got to accept the fact that it is really a wreck, and you need to identify what the issues are and then start going to work on fixing them and putting the things into place over time that builds the car that runs like, just like the old GTOs, remodeling the car. We got to remodel the healthcare system. And what that's going to look like, who knows? But at least know that you have to do it. That's the first thing. All right, this is Vic Vogel. This is What the Flip podcast. You can find me here at Facebook.com, What the Flip podcast. I'll be putting these videos in a series in this podcast. This website or Facebook page is set up to, it's more like a video web page or a Facebook page. And in there, I have some of these are considered series, which this one will be, and it'll be under America Under Attack, the Healthcare War. That's the title of it. And these will happen in sequential order, with the first one being, hey, we're spending 4 times as much more money than we had. And they talked about that last week, talked about that Monday. And today I talked about how we can, because we're spending so much money, how do we compare with other countries in similar position as we are, democratic societies, free economic system, etc., sort of comparing apples to apples. How do we stand in terms of cost against them, and how do we rate in terms of the quality of service that comes in with those? There's much more underneath this that you need to dig out. And this isn't by any way, any stretch of imagination, give me everything to know. There's more you need to dig out. But take the time to do it. Take the time to understand. You can no longer step back and set and say, okay, whoever I put in Washington, D.C., it's your responsibility, go do it. You've got to be active in providing them what they need to know. And do it in a way that's intelligent and factual so that they know that it's the right thing to do. And then hopefully the more active we get involved with them, the less likely we are to stumble into what we've had the last 4 years. Okay, we'll be able to participate and let people know whether, and that's the other thing, we need to let them know as they're going along. Biden's, he could make mistakes too, obviously. So the question becomes, if we provide them the right feedback as they're going along, maybe when they make the mistake, they'll recognize it, back up, correct it, move forward. By the time that this 4 years is over, we might actually have something that works. We won't if we sit back and just shut up, or we have the intention of helping them fail so somebody else can come in and fail again like Trump did, and then somebody else can overthrow that, and we can be on a path for failure forever. That doesn't work. That's not a healthy thing. So you need to learn about not just this, but you need to learn about climate, what's going on, what's real, what's not real about that. You need to learn about healthcare. This healthcare is predominant right now during the pandemic. Okay. And then other things we need to know along the way. We need to discover and be open to learning about them and working through them and trying to make them work for us. So we have a better country and we can lead again instead of being the last in the rest of the world. So you have a great day. Please be safe. This pandemic is getting worse and worse. Wear a mask. There is nothing political. There is nothing manly or not manly or freedom or not freedom about wearing a mask. This is all about saving somebody's life. Saving somebody's life. If you don't if you don't take the time to wear a mask, you're going to sacrifice, as we're seeing now, you're going to take privileges away from people that they were looking so forward to, because they will shut this country down to save lives when it gets this serious. They're not going to let you just go rampantly out there and kill people because you just feel like you need to have a drink at a bar, or you need to party, or whatever it is. They're not going to do it, folks. It'll be hard to deal with, but you can save lives by wearing a mask, stay home, social distance, cleanse. And then guys like myself can get back out to what we used to do instead of being locked up in what was basically it's like being in prison. You can't go anywhere. You can't do anything because everybody else out there, maybe they won't get as sick as me. I could die quickly from it. So, you're just sentencing me to more time. Okay. And I don't hold that against you, but I tell you what, it's kind of selfish to be that way. So I'm asking you, and wear a mask and social distance. If you're walking outside, wear a mask. When I go for a walk, I wear a mask because you just don't know. You don't know the full breadth of all this. Okay. So you have a good evening, and stay safe, stay secure, and hopefully this will all work out for us in the long run. All right, Vic Bogle, What the Flip Podcast. Till next time.